Hello, good morning. Welcome to today's session as part of the AMA Steps Forward Innovation Academy. My name is Laura Fritchie. I'm a project administrator for the digital health team here at the AMA. And for today's session, we're joined by several experts within the AMA as we discuss the ever-evolving and growing topic of AI in healthcare. I'm going to quickly share our disclaimer before we begin. So for today, we're going to start by hearing some opening remarks on the AMA landscape and tee up the latest AMA work and resources in this space from AMA President Dr. Jesse Ehrenfeld. And then we'll open up to a deep dive panel with several folks from across the AMA who have all been working in various capacities around AI. If there's time after the panel, we'll try and answer some of your questions, so please feel free to drop them in the Q&A chat. And if there's time at the end, we'll get to those. And with that, I'm going to introduce and pass off to our moderator this morning. Dr. Ehrenfeld is the president of the American Medical Association. He's also a senior associate dean, tenured professor of anesthesiology, and director of Wisconsin's largest statewide public health philanthropy organization, the Advancing a Healthier Wisconsin Endowment, as part of the Medical College of Wisconsin. He's a board certified in anesthesiology and clinical informatics. Dr. Ehrenfeld is one of the most respected national voices on digital health integration and innovation, having served as a consultant to the World Health Organization's former Digital Health Technical Advisory Group and co-chair of the Association for the Advancement of Medical Instrumentation's Committee on AI. He previously served as co-chair of the Navy Surgeon General's Task Force on Personalized and Digital Medicine and as a special advisor to the 20th U.S. Surgeon General. His research, which focuses on understanding how information technology can improve surgical safety and patient outcomes, has been funded by the National Institutes of Health, the Department of Defense, the Robert Wood Johnson Foundation, and others. Dr. Ehrenfeld is also a combat veteran who deployed to Afghanistan during both Operation Enduring Freedom and Resolute Support Mission. It's my great honor to introduce AMA President Dr. Jesse Ehrenfeld.
Well, thank you, Laura. It's a pleasure to host this discussion about AI applications in healthcare, its potential and the limitations, and where is this exciting technology going next. So as a starting point for the conversation, it's important to point out that AI in healthcare is not new. AI, in fact, has been used in healthcare in some form or another for decades, but has increased in its role in recent years as technology and its capabilities have grown exponentially. AI today bears little resemblance to the tools used in radiology or cardiology 50 years ago. And as this technology advances, the potential for AI to radically transform healthcare, both for patients and physicians, brings considerable hope, but also some concern about what the future of care delivery may look like. Now, already, AI models are being used to develop cancer prognoses, respond to patient messages, predict adverse clinical events, recommend optimal workforce staffing. And I'm sure we all remember that last year, an AI large language model algorithm successfully passed the multiple choice section of the United States medical licensing examination. That certainly, I think, got people's attention. But while AI technology for now is great for textbook patients or solving a narrow clinical question, it's not a suitable tool that has judgment, can handle nuance or thought. And that's why the AMA refers to this technology as augmented intelligence, because it's important to emphasize the human element that is so essential to medical care. Look, when I'm sick, I want to know that there's someone helping me who actually cares about me as a patient, somebody who understands my struggle, my pain, and who brings with them the human emotions that have always been at the heart of our profession. So, considering the transformative potential of AI and AI-enabled tools, physicians have a lot of questions. And the AMA recently surveyed physicians about their attitudes towards AI, and a clear majority see it as a useful tool that can help us streamline how we work, eliminate some of the excessive administrative hassles that steal time out of our day and distract us from patient care. But while many physicians are excited about AI's possibilities, about as many have serious concerns about the technology's rapid and so far pretty unregulated evolution. To address these concerns, the AMA released a set of principles for AI development, deployment, and use in healthcare. These principles lay out comprehensive policies for AI oversight, privacy, security, liability, eliminating and managing bias, transparency, and other issues to help mitigate the risks to patients and physicians. Above all else, we believe that AI in healthcare must be designed, developed, and deployed in a manner that is ethical, equitable, responsible, and transparent, which is why we developed these principles to guide our conversations with lawmakers, policymakers, and other stakeholders to ensure the right guardrails are in place to maximize the limitless potential of this emerging technology. The AMA and Manat Health also recently released a forward-looking report about the evolving world of AI in healthcare and what it means for the future. This AMA Future of Health report is available free for download on our website. The AMA has also created an ethical framework for AI use in healthcare and a number of learning modules to answer physicians' most pressing questions and to help people guide implementation of these tools in clinical settings. You're going to hear a lot more about all of these tools and resources in our conversation today, and you'll have the opportunity to ask your own questions to our expert panel of AI insiders. There is no doubt in my mind that this is such an exciting time for medicine as technology pushes the boundaries of how we deliver care in ways that were almost unimaginable just a few years ago. Now, it's impossible to say how many of the new AI-enabled tools flooding the market are truly going to transform medicine, truly improve outcomes for our patients. But what I can say for certain is that if physicians are not involved in the design process, if the right regulatory framework isn't in place, if AI exacerbates or worsens bias or health inequalities and introduces new privacy risks for patients, if these tools are adding to, not subtracting from the tremendous burden already on our shoulders, then they will fail. And humanity will lose an important ally in the effort for a healthier tomorrow. So with that as a starting point, I'd like to welcome our panelists. With us today are Dr. Freddie Chen, AMA's Chief Health and Science Officer, whose department at the AMA explores the ethical considerations around AI use and digital health. Also with us is Dr. Kim Lomas, AMA's Vice President of Medical Education Innovations, and Shannon Curtis, AMA's Assistant Director of Federal Affairs, whose office in Washington, D.C. looks at the policy and regulatory side of AI, and Dr. Margaret Lozovatsky, AMA's new Vice President for Digital Health Innovation. So welcome, everybody. Thank you for joining us. Let's go ahead and jump right in. I'd like to ask each of the panelists to begin by telling us what's one thing that excites you about AI in healthcare, and also give me one thing that concerns you. Freddie, let's start with you.
Dr. Ehrenfeld, thank you for hosting us. Thanks for convening this panel. It's great to be here. I am really hopeful and excited about the potential for AI to decrease administrative burden on physicians across the country, and really work on, by freeing up a lot of that time and sort of mental stress and burden, get us back to spending more time with patients, more time in the exam rooms, more time at the bedside. That really, for me, is one of the great potentials and promises for this technology. I am cautious, and given the last couple decades of experience with electronic health records and our lived experience of that a lot of times the reality doesn't live up to the hype, especially in sort of the early days. And so I'm cautious and nervous sort of about what that effect might be, and the sort of, trepidation and worry and anxiety sort of that has come with electronic health records, for instance, and what that is. And so I'm worried about that same effect happening for AI.
Thanks, Freddie. Certainly, I think a lot of physicians still have a little bit of PTSD from the bumpy rollout of electronic health records, the #1 dissatisfier physicians for years running. It's now #2, prior auth is #1. All right, let me turn to Kim. What's one thing that excites you about AI and one thing that concerns you?
Well, thanks, Dr. Ehrenfeld, as well, for the opportunity to be here and speaking with everyone. So in the world of education, we recognize that one of the true joys of our profession is that we continue to learn and grow throughout our entire career. And, traditionally, we've tended to think about education as something that happens away from the workplace for the most part. And I think these tools will offer an opportunity to integrate learning in the work process in a way that we've never been able to imagine before. And to your point about augmentation, it's not only providing support for a given instance, but also real-time education that's much more relevant to the practice of the physician. So I'm very excited about that potential. In terms of concerns right now, as you point out, we lack expertise in judging these tools. And these tools require an infrastructure that many health systems and educational programs don't currently possess. And so there is some concern that there would be disparity among healthcare organizations as well as educational institutions in their ability to ramp up. And so you could have very disparate experiences of learners and physicians across different organizations.
Perfect. Let me turn to Shannon.
Great. Thanks so much, Dr. Ehrenfeld. Not to be too repetitive here, but piggybacking off Dr. Tan's comments about the opportunity, we're really seeing great opportunity here on the administrative burden side. We know what a significant issue burnout and burden is for physicians. And I think if AI is really ripe for anything right now, it's probably in that area, and maybe a little bit less so for the clinical application side of AI. So very excited about what we're seeing there, and very excited to help promote use and growth in that space as soon as we possibly can. I think what concerns me is this idea of risk and risk mitigation, and ensuring we appropriately manage and mitigate the risks to patients and frankly to physicians as well, in the form of potential liability for these tools if they do go wrong. If we don't appropriately manage the risk and engender trust in these tools, we're going to have an integration problem. Physicians simply won't use them, and if the risks are not appropriately managed, they probably shouldn't be using them. And if that happens, then we lose all the opportunity and the promise of this new technology.
Thanks, Shannon. All right, Margaret, what excites you? What terrifies you?
Thank you. Thank you for having me. I'm thrilled to be here. A lot of the other panelists mentioned administrative burden. That is certainly something that excites me. And I think that the cognitive burden that physicians experience on a day-to-day basis with the amount of information we have to process is an area that I hear the most about from my colleagues when I am taking care of patients. And so that is what really, to me, is the promise of this technology, the ability to take information, collate it, and present it to our clinicians in real time in a way that is appropriate for them to be able to make decisions quickly, efficiently, and take care of our patients in the best way possible. The area that I would say concerns me is all of the things that we learned from other clinical technology implementations. So we learned how critical it is to integrate these technologies into the workflow of the clinicians, meaning that we see them as an enabler so that the technologies help us care for patients. And with the fact that these are so new, we're still learning how to do that appropriately. Several people mentioned that there's not necessarily governance in our organizations to be able to manage that. And so figuring out a thoughtful way to implement these technologies and doing it methodically across our healthcare universe, to me, is where we need to be very, very careful and where I want to make sure we continue to support our clinicians.
Margaret, thanks for that. And that whole idea of surfacing information to help with some of the coordination challenges we have is I think, a place that there's so much opportunity. I was running a code in the operating room last week, and in a moment where you're trying to surface the information that you need, right, in a critical juncture, while communicating and managing, a team of folks who are trying to respond to an urgent situation, is one example of a place where obviously these tools can be really, hopefully, potentially valuable in coordinating information and how things are sharing. So let me stay with you. If we look at the practical uses of AI, how can augmented intelligence alleviate some of the burdens contributing to physician burnout and improve professional satisfaction in day-to-day clinical practice?
Yeah, that is a fantastic question, and exactly where I see the promise of this technology being so critical. I take care of patients in the hospital, and I think about the days that I'm there. I did a shift last week, the number of patients I'm managing at the same time, sometimes upwards to 20, 25 patients. And so to me, that is where this technology can absolutely support our clinicians, where it will help monitor some of the things that are going on with the patients, collate that information, and present it to us in real time. So if I'm worried about a patient deteriorating, the system is able to collate the data that is relevant to that deterioration and present it to me in the right time at the right place. I think that a lot of clinicians struggle from the administrative burden, right? And we talked about that, all of the things that we're managing outside of the clinical care, so we can't focus on the care of the patient. And that is another area that this technology is ripe to support, again, to perform those tasks as an augmented function so that we can make the clinical decisions and we can focus on what we love to do, which is taking care of patients. I had done a study in my previous institution with my team where we looked at these tools and what excited physicians about that. And what we learned is that even though sometimes we are not spending less time in the system, the time that we're spending makes us much happier when it's doing the things that we love to do, which is practicing medicine and putting the administrative pieces away. And as you mentioned, the AMA survey showed a lot of the same things, that most physicians see that the promise of this is really in taking away that extra burden, the cognitive burden, the administrative burden away from us.
So let me ask you, so there's so much hope around alleviating administrative burdens. What are some of the key considerations that a physician or health system leader ought to be thinking about as they're planning to do some of the implementation work around AI in practice?
Yeah, this is an area that is evolving and we're all thinking about, and many organizations are in the very early stages. I would say the number one thing people need to really consider is the governance process of how to bring these technologies into the clinical spaces. So who needs to be involved in the conversation? A lot of times we have technology that is ahead of where we are with operational and clinical point of view, right? So we need to make sure we have operational leaders. We need to make sure we have technology leaders, of course. But most importantly, we need our physicians, our nurses, all of our clinical team members to be engaged in this conversation so that we understand how they're going to be used in the clinical areas. And the governance model has to be mature enough to be able to analyze these tools for all the risks that we described earlier in the conversation, so that before they make it into the clinical spaces, we have thought through all of the workflow considerations, all of the ethical considerations, all of the risks that we talked about, and that the tools are mature enough to be an enabler for us to care for patients.
All right, let me turn to Freddie. So the ethics of AI development and its use really sit at the forefront of conversations about AI and for physicians looking to implement it and use it in practice. what are some of the concerns that exist today around the ethical use of AI? What frameworks or support is out there that can help physicians thinking about leveraging these tools?
Yeah, thanks, Jess. Part of my role is to oversee the Code of Medical Ethics for the AMA. We have the council, we have the Journal of Ethics as well. This has been a key sort of topic of conversation sort of in all of those groups. Initially, there was some question, we were here, do we need to rewrite the Code of Medical Ethics for AI, right? Do we need a whole new section of the code just to address AI? And I would just remind us, and this is sort of where our council has been thinking and where our discussions are, that the principles of medical practice set forth by the code are alive and well and absolutely applicable to this work. So informed consent, respect for privacy of patients' information, privacy of data, right? Those kinds, and then acting with professionalism. All of those elements continue to inform sort of not just our day-to-day traditional practice, but how we now think about using new technologies like AI. So I feel, on the one hand, I feel like we absolutely need to be looking at updating and need to be looking at sort of new applications of these ethical principles and the code, because we've seen challenges already sort of in the implementation of AI. And at the same time, it's a great reminder that we actually do have, in fact, a really clear North Star in terms of how we should be acting and how technologies like AI should be augmenting sort of our work.
Well, I'm just glad that you didn't tell us that you were planning to use a large language model to rewrite the Code of Medical Ethics.
Yeah, we did that already.
Like it would not be.
The original was better.
Let me stay with you. So development of AI models has exposed certainly the risk of underlying bias that exists in a lot of data sets. What should healthcare organizations, physician practices be thinking about? What steps should they take to ensure that an AI algorithm doesn't contribute to worsening biases in the delivery of patient care?
Yeah, this brings up so many important issues for how we implement this technology into our daily practice. But well before that, many of us work in hospitals and health systems. Many of us are not involved in these discussions about, should we turn on this technology? Should we buy from this vendor or this vendor, and how does it work? And so at one level, the day-to-day clinical practice, that's where we start to see we have to be really vigilant about, does this technology work in the way we think it's working? Do we know it's working? Do we know how it's working? And then what red flags are raised for you as an expert, excellent clinician, sort of in the implementation and application of this stuff, that it's really going to require our attention sort of at all stages of that. I think like with any technology, I think the first question is going to be, is it working? Is it working the way we thought it was supposed to work, right? And that's going to require physicians' input and acumen on that. And then the other issues become, do we know how it works, right? That's where the biases that might be, do we know that it's embedded in this, in your electronic health record now? Do we know that it's working right now? Do we know if it's working correctly? What's the transparency and visibility to that? Those are really important ethical questions that we as a profession have to deal with on behalf of our patients too.
That foundational question, does the tool work? It's getting complicated, right? It's not like a drug or a biologic that's gone through an approval process where there's a table and a package insert and it gets tricky, certainly when we're talking about algorithms embedded in systems where there may not be transparency, that there's something happening in the background that's influencing information you're seeing or a recommendation that's being brought forward to a clinician. All right, let me go to Shannon. So Shannon, as the number of AI-enabled healthcare tools and systems is growing, we believe that these technologies have to be designed and developed in a way that's ethical, equitable, responsible, transparent. We know AI has been around for a while, but the explosion, large language models, OpenAI, ChatGPT, happened about a year ago. Can you talk to us about the regulatory frameworks that are already in place or are needed to govern the development and deployment of these AI systems in healthcare from a policy standpoint? What are the gaps? Where do we need to go?
Yeah, sure. And, that is, I'm sure as everybody knows, a really challenging question right now and something a lot of us are grappling with at the physician level, at the broader stakeholder level, at the industry level, at the government level. And frankly, the kind of concerning piece is, gosh, we're at least 5 years, behind, given the explosion in technology that you've mentioned. But our gold standard of regulation here is really the FDA. I think a lot of us are familiar with, the FDA review and approval process. And that has been the one thing in the physician world and in the medical world that has ensured our safety, our efficacy of drugs and devices. The key word there for AI being devices. The FDA only has authority to regulate a tool or a technology that meets the definition of a medical device. So you think something that's diagnostic, and that's been where we've seen the bulk of the AI approvals so far in these diagnostics, kind of triage functions. So they are actually limited in this space as to what they can regulate. These tools we're talking about for administrative functions, likely a number of CDS, clinical decision support tools that we may see eventually, may not ultimately have a regulatory home within our current regulatory structures. The FTC can get at pieces of this from a kind of consumer protection standpoint, false, deceptive uses or outputs of AI, things of that nature, but they're also incredibly resource constrained. So I don't know how active they'll actually be able to be in this space. We have some federal protections at the Office of Civil Rights around protections against discrimination, things of that nature. But there's a lot, frankly, that's not spoken to when it comes to AI and regulation right now. We certainly don't want to over-regulate it, so we stifle everything. But we do need some assurances that these tools are good, that they perform well, that they're safe, that they're as free from bias as we can potentially get them. So where we're at from the AMA is that we're really calling for more attention to a national strategy and national governance policies towards AI, and really doing some deep dives on where there are those gaps and how we can handle those. I would guess ultimately we're probably looking at something that is more of a standards-based regulatory system. Whether that's voluntary or mandated kind of remains to be seen, but at least some industry accepted standards for design, for development, for deployment, that these tools have to meet before they're out in the ether and the public space. I think there's going to be a big push for, like Dr. Lazavatsky mentioned, governance policies within institutions, within systems, about how these are purchased, how they're implemented, things like that. And we're really going to need some clear messaging on the liability here. Unfortunately, that might not be with the government. That might ultimately come through the court system. But the less regulation there is, the more questions we have about where liability falls. And, industry certainly would like to get rid of liability to the extent that they can. But they're also very cognizant that if physicians are left with too much liability, that they're not going to use these tools and the whole thing is going to be for naught. So we're really actively engaged with the federal government, both on the agency side, with the departments, and with Congress on what we need to do, what are next steps here. And actually just this morning, we saw some guidance from the Office of Management and Budget within the federal government that was geared towards federal agencies' use of AI, but is really a first attempt at outlining what types of safeguards need to be in place and what kind of documentation and what kind of transparency needs to happen around these tools. Again, only applicable to the federal government. It just came out this morning, so I don't know what all is in there. But I think a real concern for safety and protection of civil rights. So that'll be an interesting kind of precedent to take a look at to see where the feds might be thinking and where things might be headed. So
sounds like that may be some foreshadowing of what could be a future regulatory framework. All right, Kim. So Kim, for future physicians in medical school that are going to be exposed to AI in training and throughout their careers, how is medical education evolving to prepare future physicians to use these tools? I'm going to a ribbon cutting for a brand new medical school next month, really excited. What should I expect to be seeing as new programs are being developed and existing programs are retooling?
Well, yes, Jesse, and as you're aware, it's not just future physicians, right? So there is an immediate need for upskilling of physicians at every level of their career. And so we're thinking really broadly. And it is interesting. I represent the AMA on a group that's out of the National Academy of Medicine that looks at the need for innovation across health professions. And we actually started talking about AI as a topic around 2020 and put out some commentary in 2021. And at that point, people weren't really willing to hear it. Our goal was to raise urgency. As Shannon said, we're way behind on providing this kind of training. And in recent years now, with all the attention, that same group of authors were being pinged to speak all over the country and around the globe, honestly, about these early ideas. So we've been a major force in galvanizing the medical education community that, yes, we must engage in this and provide training to our future and current physicians. So right now, the question is, what are the general competencies that should be promoted among our learners? And a lot of what we've already touched on here are the main components. Understanding fundamentally what AI is and how it works. You know, there's a lot of attention on generative AI, but there are many other dimensions that I think most people aren't really thinking through. So that big bucket, understanding the ethical and societal implications and the regulatory issues that have been addressed here, in understanding those limitations on the tools. Trying to understand how the physician will communicate to the patient about the tools. So the role of being the explainer of how this is factoring into the patient's care is a new form of communication that we're all going to have to get comfortable with. Thinking through our role as physicians in the ongoing monitoring of any tools that we're using. And that brings in a new kind of expertise around evaluating these models that's been alluded to here already. So those are some of the big chunks of competency that the community is thinking through about how to support. And, you know, for an immediate action, our unit in MedEd has collaborated with leaders at the University of Michigan who have an interdisciplinary work group there. And we've created a series of online modules as a quick start, since many places do not have these resources. And we're proud that those are open access so that everyone can start to immediately learn. And they're designed around students, but they work great for all of us. I've learned a great deal from helping to create them myself. And then finally on MedEd, there's a second angle to it that maybe we can talk about some more, that is, how do we leverage these tools to improve the process of education itself as well?
Fantastic. Those modules are great and they're free and available, and I would certainly encourage folks to check them out. So, you know, AI is here to stay. Its use is growing in a whole variety of settings. Let me maybe ask either Kim or Margaret, what can healthcare organizations do to foster a culture of continuous learning and innovation to support the use of AI in the delivery of patient care?
Thank you. That is a great question. I'll jump in and then I'll let Dr. Lomas fill in what I missed. I would say there's a couple of areas we need to be very thoughtful about when it comes to education of both our learners and all of the physicians out there, making sure that people understand, as Dr. Lomas mentioned, what the output of these tools is and how to interpret it both for their colleagues, for their patients, for the care of the patient in the moment. That's going to be really important. And thinking through, as we're building these tools, which we haven't always been intentional, how to integrate that into our educational framework from the beginning. When I came out of training, we were on paper. And so that was not part of our training. But today, clinical technology is integrated into everything we do. And so really important to make sure that from the very early days, that is integrated in the way we teach people how to practice medicine, and that they understand that all of the technologies that are coming at them, the AI tools and all of the other clinical technologies, are going to help them care for their patients.
Yeah. Kim, anything to add?
Sure, I'll jump in. I think there's also a bit of an identity shift that's going to occur, right? If you look at how we've historically selected people to the profession, it's been primarily anchored in one's ability to possess a body of knowledge. And our entire structure has been reinforcing of that concept. We need to have a little more humility, and healthcare organizations need to foster an environment in which we acknowledge that all of us will benefit if we bring a strong knowledge base as individuals, but then we are augmented with these tools. And a lot of current cultures really don't reinforce that of being able to say, I need this support and I'm going to use it to the benefit of the patients and the community. And so how to build a shift in mentality of even an organization saying we are the best, which implies a static state, as opposed to we are striving to be the best every day, and we are using every tool and every person to do that. And that projects a different attitude for everyone in the system, including our learners, and the workflow issues that we need to address that allow the cognitive white space to continue to learn and grow, that the current emphasis on clinical throughput and clinical productivity doesn't permit us to do. So there's an organizational culture element to this that I'm very excited about that should really potentiate our ability to learn throughout our careers.
So, I've been out on the road. I know a lot of us have been out, Vive, HIMSS, South by Southwest Health, and a lot of the conversation around AI centers on this theme of trust. So Margaret, let me ask you, when you consider the potential of AI to empower patients in taking control and managing their own health, how do we preserve trust for both physicians and the healthcare systems and practices that are leveraging AI and patients in this rapidly changing landscape?
Yeah, that is a fantastic question. And we have started down this journey with patient portals, right? Early in the iteration of clinical technologies by giving patients information. And now we're releasing it in real time. And there's a lot of concern that folks aren't getting the right pieces of information. As we add these tools into the environment, that becomes even more complex. And to me, the trust in that physician-patient relationship is at the center of how we provide clinical care to our patients. So as we think about integrating these tools into our clinical care, it's going to be really important for us as physicians to have the background and education on how to use these tools, understand the outputs that are coming at us, and that concept of augmented intelligence is really critical here, because at the end of the day, these tools are going to give us information and the clinical decisions will still be made by physicians. And so to maintain that trust with the patient, that piece is going to be really critical to understand those outputs, use that as one input into our thinking in the diagnosis and interpretation of the patient diagnosis. And then as we're communicating with our patients, it's going to be really important for us to be able to explain that to them, to help set expectations of the things that we're using so that patients know and understand how we use these tools. And that's why, again, it's really critical from the beginning to design them and think about the ethics piece and make sure we minimize bias, because as these tools are being used, they are going to impact patients, and we need to be very mindful of that from the start.
All right, let me come back to Shannon. So Shannon, given the rapid pace that AI is rolling out, what role does the AMA, what role do other professional societies have in shaping policy, and what other groups are emerging that might help play a role in setting the standards that you say are going to be so important for augmented intelligence's use in clinical practice?
Yeah, sure. One thing I think is exciting and an opportunity is that I do think that the physicians will have a big opportunity to help shape policy here. You know, it started out several years ago as industry really driving this conversation has, you know, pretty rapidly morphed into an environment where industry now understands that they have to have us and how critical our voices really are in this conversation. Because again, like I said earlier, physicians simply won't use these tools if they're not good and the risks are too high. So how do we make them comfortable with integrating these tools into their practices? You know, I think the specialties are going to have a very interesting role to play here, and that I do think a lot of kind of what maybe ultimately morphs into a standard of care is going to be very specialty specific, and that standard of care has got to be considered with how these new tools are really, you know, integrated, and if they start defining potentially a new standard of care in some ways for different specialties. But that's going to vary widely, and the specialties will have a lot of work to do to determine what is right for their own members, and will have a big role to play in really outlining how these tools will benefit their specialties. I think they also really have a big role to play with us in the broader policy conversation. You know, the AMA is working right now to develop what we're, you know, terming a physician specialty collaborative. That is a gathering of representatives from any specialty, frankly, that was interested, to help provide us input to drive a lot of this work, to drive what the agenda looks like, to help us develop that guidance for both policymakers and potentially for physicians as well, around these really important topics like generative AI, like the administrative use cases that we're seeing and things of that nature. But there are a number of outside groups as well that have sprung up that are trying to play in this space that I think is really important. Groups like the Coalition for Healthcare AI. I know the Consumer Technology Association has even done some work in this space. And then you have your federal players like NIST, that's a standards developing body really that has done some really good work and some risk management framework and things like that for AI already. You know, the problem I think that we're facing if we're talking about standards is everybody wants to put out a white paper and everybody wants to talk about frameworks right now.
Yeah.
And if you've got 50 frameworks and 50 standards, then you really don't have any at the end of the day. So somehow we're going to have to start coalescing around a few key broadly accepted, you know, groups or governmental entities to engage in this important work.
All right, we are getting a flood of questions coming in that we're going to turn to in just a second. But before we get there, let's do the lightning round. I would just love to hear from everybody what's ahead, what's going to be on your radar in the coming year. Freddie, why don't we start with you?
Yeah, we're working closely with Duke University and the Health AI Partnership around an ethics use cases and sort of examples of that, and also some community sharing with it. I'll just briefly also say AI is something that the entire AMA is focused on. Every unit, as you've already heard here, from advocacy to medical education to ethics, is involved and engaged. We're talking with each other, very importantly, and then we're also really trying to represent the whole profession around the impacts of it. So I'm really excited to see that.
Perfect. Margaret?
Yes, absolutely. As Dr. Chen mentioned, we are all working together to make sure we're supporting physicians in the evolution of AI. We are starting the specialty collaborative, as Shannon mentioned, and that's going to be really important to meet the needs of the various specialties. And most importantly, we are keeping an eye on all of the things that are happening and getting that information to you so that we are aware of the new tools coming out, the use cases, and we will support physicians in the evolution of governance around these tools.
Perfect. Kim?
In MedEd, we're really excited about the potential of AI to improve the process of education and training across one's career. And so we've worked with our community of innovators across the country to define the concept of precision education, which is the use of data and technology to personalize education, make it more relevant and efficient for trainees and physicians. And we've been supporting some projects in this area and hope to move that forward into a major initiative, collaborating with other teams across the country.
All right, and Shannon, what's on your roadmap for the coming year?
Well, I think probably as I already mentioned, here from our office in DC, we're really trying to drive the policy conversation across all interested parties. So industry and other stakeholders, and definitely with our federal regulators and then with Congress. So you mentioned our new principles that we have, our advocacy principles. So right now we're really pushing those as a little bit of a roadmap for maybe what's ripe for next steps in the policy world. And really importantly, we are really trying to lay the groundwork for ensuring that physicians have a seat at this table, that the AMA and other specialties are key resources for the policy conversations here to make sure we really can drive our priorities as regulators in Congress are looking at taking next steps on this issue.
Fantastic. All right, so in the time remaining, we're going to go to these questions from the audience. Feel free to keep putting them in there, and we'll get to as many as we can. We've got about 15 minutes left. So first question from an AMA member who has a strong background in medicine. They're an internist, it sounds like, computer science, digital technologies. They want to know, how can they get more involved as an AMA member in digital health? Are there places that they can plug in? Anybody want to share ideas on that?
Yeah, absolutely. Love the enthusiasm. Thank you for the question. We would love to have more involvement. As we're starting up the Specialty Collaborative, that's a perfect opportunity for you to get involved. Also, feel free to reach out directly to me, and we can talk about any way that we can support you and your work. Our goal is to make sure that we are supporting the leaders out there that are grappling with ways to implement these technologies.
And there's also, of course, the Physician Innovation Network, free online platform available to anybody to connect physicians and learners with industry, entrepreneurs, companies that are trying to develop these digital tools. There are something like 20,000 people on the platform now. It's free, it's online, and that's another place to plug in, and would certainly encourage folks to check it out. All right, next question. How will concerns for transparency be balanced against a developer's desire for having their own proprietary information, business secrets, R&D might get expensive as we're trying to balance those things? Any thoughts on that?
I'll start by saying this is precisely what the AMA advocacy principles is seeking to address. We're seeing a dialogue sort of between developers and as they recognize not just the importance of physician input in this, issues like liability that Shannon raised, like they don't want to take all the liability. They also recognize that if physicians are given all the liability, we won't be using the tools either. And so sort of where does responsibility really lie in that? Who are the players that need to be involved in that conversation? And we're really still in the early days of this, but it's been heartening, sort of the exchange that we've had, I think, with industry and with developers. They want to hear from us. We have things to say.
Yeah, and I would just add to that, if folks want to take a look at our new principles, we did a lot of work with our specialties to basically create a list of items that we thought were very important to be disclosed by developers. It's not the inner workings of their algorithms and every single, minutia of their business plan and their proprietary information, but we did identify several key items and points that we think maybe need to be on a product label, but should definitely be disclosed so that physicians can adequately evaluate the tool, its intended use, its intended population. And again, that's really meant to be protective of physicians and your patients at the end of the day. We don't want folks using tools that they didn't have a chance to evaluate. And we certainly think that potentially increases and exposes physicians to liability if they don't have that information. But it's very similar to what we have now for devices, package inserts, things like that, labeling requirements. We're not asking for much that's different than that.
So there are a bunch of questions that are kind of on the same theme. Some of them are especially specific, some of them more broad, but they're about how do we, as a practicing physician, start to approach incorporating AI into diagnostic decision-making, whether it's radiology, pathology, gastroenterology. What should physicians do, and where can they turn to as they're trying to figure this out?
So I would say that this probably depends on your practice environment, but in large, as you look at your organization or your practice, you probably have technology teams or somebody that is helping you with your technology implementations. And what's really critical is to have the physician voice. So I love this question because it's really important to have physicians that are at the point of care or as close to the point of care as possible in this conversation. And that's where we should make sure that you're partnering with your technology teams in that conversation. They can help with the technology conversation, and it is our role as physicians to help them understand how we need that implemented in our clinical environment, and that partnership is so important. If you have a clinical informatics team, reach out to your team. Ask them about the processes in your institution and how you can work with them to make sure that you are a part of the governance that exists or that is evolving as we talked about today.
So Margaret, let me stay with you. Another question from somebody in a small primary care practice. You know, time, money are scarce. They don't have a big team behind them. How can they get started with using AI to improve the health of their patients?
Yeah, and that's a fantastic question, and that's why your environment is so important. So if you're in a small practice, the AMA has developed a lot of materials to help you understand what are the technologies that are out there today, how they're being used. So we just released the AI landscape report about a month ago. I would encourage you to look through that to help you understand the options that you have today and work with your group to understand how they can support you in your specialty.
Okay, I think this question probably goes to Freddie. If you're using AI in a patient interaction, do you need consent from the patient? Does it have to be written?
I would say you absolutely do need consent. I think that's where, you know, I would say we're still figuring it out. But I think that in general, these principles about data privacy, data sharing, information, the same way that you have your patient's information in your electronic health record, you need consent sort of from them. Now, the process of that consent, a lot of times, as you know, it's the patient signs that sort of digital signature when they're checking in, and that's it. I think where we are is really trying to challenge us as physicians to understand these technologies better, to understand the implications so that we can communicate it clearly and effectively to patients as well as for ourselves and how we're using it. But I think that the privacy issues, the informed consent issues are longstanding and well established in other areas of technology, and I'm sure we'll see the same thing in AI. Plus, your lawyers are going to make you do it.
Speaking of lawyers, couple of questions, and maybe we'll go to Shannon for this, given your expertise. A question about liability, right? What happens when something goes wrong, if there's an error on an AI recommendation or an automated process? Is the AI developer liable? Does that liability fall on the physician?
So that's the big unknown question we have right now, right? And that, you know, there's some interesting thoughts here in that, you know, really kind of your traditional notions of medical malpractice still hold. If you're using a tool outside its intended use, that's still going to be a you problem at the end of the day. You know, if there's some negligence in using it, if you're acting well outside the, you know, the standard of care for your specialty, those are all going to be problems, and we're not going to ever be able to get you out of those liability questions. But if the AI is not performing adequately, that's the really interesting question here. And the question that we're facing is this idea of relying upon an AI. How much can a physician rely on it? What does rely, you know, mean? We're trying to say that the physicians here are the ultimate decision makers, but if you can't rely on an AI tool to help inform that decision without incurring liability, where does that leave us, really? So that's a question I think is yet to be decided. I'm sure at some point this is going to go through the court system primarily for those decisions. But our position as the AMA is that the party best situated to mitigate that risk should be the one held liable for it. So our position would be when you've got a poorly performing AI, as long as the physician did everything right, didn't act with negligence, is not well outside their standard of care, then the device manufacturer really should be liable for a faulty device. But this is a little bit less cut and dried than, say a hip implant or a pacemaker or a hardware device having gone bad. So it'll be interesting and a lot of unknowns.
So next couple questions. There have been some failures, right, at scale of AI algorithms deployed. What can we learn from some of these early experiences where things have not gone so well?
Is that still for me or others jumping in? I could take a stab at it. From my perspective, as somebody that works within the regulatory system, to me, this is a clear demonstration of where there truly is a need for some type of strategy, standards, regulation, governance to try to mitigate those risks and control for those situations as the best we possibly can. Like, we cannot be a Wild West free for all on this front where everything's just willy-nilly wherever and however. And so to me, this is a case for a little bit more effort on the regulatory side and really doing some deep, hard work on figuring out what the best way to mitigate these risks are. Because I personally don't think that we are there yet. And I think there is a lot of work still to be done. Hopefully this guidance that came out today will start being a little bit instructive about how maybe we should start thinking about these outside of just transparency. We'll see. But I personally think it's a case for a little bit more regulation or guidance. But I'd welcome others' thoughts as well, since I'm stuck in regulatory.
Let me push ahead because we've got so many questions and there's just so much little time. But one question that's really interesting is, could there be an unbiased organization that could review or certify new tools? Regulating the design might help, but it might also suppress invention. Is there a role for that? Are some of these coalitions trying to do that were referenced earlier in the conversation?
I personally think that there probably is a role for that. We probably could look at engaging some groups that were external validators of some of these tools. You get into a little bit of a challenge as some of these algorithms are very brittle and you can't necessarily move them around a lot. They need to be validated at the site they're using, but some of them probably don't. And so I think there is a role potentially there for providing some type of validation service or some type of accrediting service or something, as we've already seen, in the diagnostic space and things like that. So it'll be interesting, but I think some folks are interested in exploring those types of options and opportunities.
All right, I love this next question. How do we maintain a human touch when organizations are increasingly integrating new technologies, AI services, and digital touch points that seem to remove the physician from the delivery process?
I love that question too. I'll jump in. I think that's the question of the hour, right? The more technology that's integrated into our clinical areas, the more challenging it becomes to maintain it. And yet it is so incredibly critical. Those human relationships are at the foundation of how we provide clinical care. And so my answer to that would be, is for all of us to be engaged in the conversation so that when the design of these technologies happens, the workflow development, we ensure that it is designed in a way that allows us to keep that patient relationship. That's probably where I personally get the most joy when I take care of patients, is those conversations with my patients, the human touch, and we can't lose that. And that's why these tools have to stay augmentative and they have to be there to provide information to us and support the human relationship.
All right, so the very last question, which kind of follows on that, is what can we do to influence AI, how it's designed, how it's implemented? We get the principles, but we don't want to just be along for the ride. What should physicians be doing, demanding, advocating for?
I'll jump in because the common theme here that we were just talking about is really trust, and we maintain and create that trust through our personal relationships, right? You trust your iPhone only so much, but then your relationship with your doctor, right, is sort of what we're actually talking about. How do we to get this last question? It's really, you have to be involved and engaged, right? I mean, we have to be. You have to be there. You have to educate yourself. It's the same as with any other sort of new technology, and then you have to see sort of where it's happening in your environment, in your setting, and you have to be sort of part of those conversations. And what you bring is this the primacy of the relationship, right? And that trust. You know, when the technology companies are talking about trust, and we are the ones who are the owners of that trust and the facilitators, that's why you get a seat at the table, and that's why we have to be part of that discussion.
That's perfect. Well, that's going to close us out. Margaret, Freddie, Shannon, Kim, thank you so much for this wonderful discussion, and thank you everybody for your questions. I'm sorry that we weren't able to get to all of them. There's so much interest, so much excitement around this topic, and I know that this is really just the beginning of a number of conversations that are continuing. In the meantime, I hope everyone will look into the resources that the AMA has made available to help physicians make sense of the ever-changing landscape of AI technology and its growing applications in healthcare and medical education. Thanks to everybody for joining us, and wish you good luck.